I spent 21 years at a teaching hospital in Manhattan, and I was recruited to come up here to the Arnot Medical Center.
When I came here and interviewed and I met the people and I learned more about the system, I just fell in love with it.
Part of the reason why I came here is everyone seemed to really work together well. It was a good, friendly environment.
Things certainly have evolved, and Arnot Health has evolved with the times. Physicians have come together, coalesced into a group we call Arnot Medical Services.
And this is a physician-led and physician-run group which provides support for our practitioners.
I find that very unique and advantageous to have a physician-led administration, very ready to hear what you have to say, very open to new ideas and changes and suggestions.
We are providing the best care, the most cost-effective quality care possible, and it's integrated. We are committed to being at the forefront of technological advance, innovation, providing the best care with the best equipment, the best facilities.
Modern operating rooms, cardiac catheterization with state-of-the-art equipment, and a brand new ward and step-down, remarkably comfortable accommodations with a nice view of the hills, something that exceeds anything available in Manhattan. But the most important part of this is not really the building, but the people.
We use the same equipment as any of the big centers. Really what it comes down to is, again, that personalized level of care.
Care to the patients that is as good as you can get anywhere, but is marked by a personal touch.
We have the right amount of nursing staff and support staff available. They're experienced, they've been here for a while. Coming from a system where I had to do a lot of things myself to a system where I get a lot of assistance, I find that I can be more productive.
We're large enough that we see the whole panoply of patient challenges, diseases, pathology, and what have you.
There's a lot of folks that really need care. We have a high disease burden.
That's attractive to me personally, and I think to most physicians, to have that exposure.
Delivering effective, excellent care to those people, including preventive care, is going to be very important.
You're going to be doing really good work. You're going to make a difference in the health of the community.
There are great compensations here. The reward of caring for the patients and a personal relationship with those patients.
Being able to provide good care and getting to actually know my patients. I like the idea of having that close-knit, knowing the people that I'm working with. To me, that's important. I think you can provide better care in a setting like that.
The everyday work, people that you work with, they can make or break it for you.
The ability to work with a small and consistent number of high-quality individuals makes a difference and makes it a great place to work.
It's not just what you do at work, but what you do outside of work, geographic locale, the kind of commute you have, all these things matter. I find this area is great for bringing up a family, places to go, things to do. There are lots of museums.
There are excellent schools here. Enjoyed the wineries, the national parks, fabulous golf courses.
If you like nature, if you like lakes, a cohesive community, this is a place to come.
I think I kind of have the best of both worlds where, I can live in a smaller community that I want, but if I want to get away, it's right there. I can jump on a plane or drive a few hours.
New York City and Philadelphia, Baltimore, DC, never really very far away. So the best of all worlds.
It's, centrally isolated. I can come home and have that close-knit time with my family and the community, but if you want to go out and visit or see things, you can. To me, that's perfect.
The extra couple of hours a day that I've gained back from my 2-minute commute is really good for the quality of life.
I have to admit, it's a very stress-free life here.
Finding a home is easy. AMS has relationships with the local realtors.
There is a lot of inventory of great real estate for purchase or land to build. We've been in our house now 5 months and loving every minute of it.
One of our biggest strengths here is really about our primary care base. So if you're a specialist and you come here, you don't have to drum up business. We have 80 primary care providers, and that is a ready set paradigm for referrals.
We're looking for physicians who want to be part of a bigger team, looking for a family-friendly environment. We believe we have that.
We really do strive to make it a good fit for people to understand who we are, and we understand who they are.
Some of the best surgeons that I've ever worked with and learned a lot from work in community hospitals. I really think that they're just kind of hidden gems.
You can see a lot of examples of healthcare systems that are run by non-physician administrators, and people working there are not happy. You only have to come down here and experience it in person to realize how good this place is.
The people that I've met here have all been big factors in me deciding to come out here.
I'm coming up to 3 years here and couldn't be happier.
All the requisite equipment, facilities, and frankly, the people, the most important piece, physicians, the support team, it's here.